Doing some follow-up. I'm Armstrong.
Sure.
Thank you.
What's
Your
the
name?
bill, Karen?
Lindsay?
Diana, sure.
Diana?
Jake.
Jake? Okay, Jake, Lindsay, and Diana. So, you did not know the bill had passed?
No,
Oh.
we're not from town. So
Where are you from?
Indiana.
Indiana. If you could give the president advice on the kind of health care bill that should pass, what would you say to him?
I work in the healthcare system.
Oh, good,
I
good.
work in emergency rooms, so I see a lot of abuse used of the healthcare system, especially from those that are on government-sponsored healthcare like Medicaid, Medicare. Well, not so much Medicare, but Medicaid. It would be nice to find a way for those individuals to have access to healthcare for non-emergent things instead of using the emergency room for those, that we don't have to waste our time and money trying to take care of those individuals that really aren't as sick and are there for chronic pain medicines or other health issues that could be managed as an outpatient instead of from the emergency room, because the cost for an emergency room visit for a cough or cold is 6 or 8 times that what you're going to pay in a normal doctor's office. So if we can find them a way to get in to see a regular family practitioner on a regular basis and prevent their chronic medical illnesses from getting to the point that they need to be seen in the emergency room, I think overall, countrywide, that would probably save a lot of money.
Lindsay, what are your thoughts on the public option? What do you think about the government replacing insurance companies? You think it has a
I
workable
think it's
chance
wonderful.
at all? Oh, you do? Tell us why.
Well, I think it's good because I think insurance companies dictate and delegate too much what doctors can and can't do and control. I don't think that the relationship between the doctor and the patient is as strong as it can be, because the physicians often have to change their form of treatment based on how an insurance company can or can't reimburse for that patient's treatment. You know, if for instance, if I have patients that come in that their insurance companies don't pay for a certain medication or for a certain test, I have to change the way that I'm going to treat that patient, because I can't always do what they need because their insurance companies will pay for it. So if I can get it where I know it's going to be covered and I know I'm going to get reimbursed for it, because why would I do a job? I mean, I don't work for free. I shouldn't have to work for free, you know, so I like to be able to get reimbursed, which sounds selfish, I guess, but, you know, I like to...
That's the American way.
Well, but it's a job. You know,
It's
I
a
have to make a
job, right,
living.
right,
You know, I
yeah,
mean,
right.
I have to make a living. So it would be nice not to be able to do what I need to do for the patients, but at the same time, trusting and knowing that I'm also going to get paid for doing that job.
So, given the government's track record with Medicaid, Medicare, and Social Security, you would still trust the government to handle this arduous task? You really think the government is... Because many people will say you cannot look at many things that the government is taking over.
Well, how good of a job is the insurance companies doing?
Well, you know, they will say to you that 80% of the people in this country are satisfied with their insurance and with their health insurance. Why would they be satisfied? I'm just playing devil's advocate here.
Well, I mean, because they don't have to. I mean, the employers are helping by not having to pay the premiums. I mean, most of the times, employers are paying 3 and 4 times what you're paying for your premium for you. So, I mean, it's in a sense cheaper for some people, but for those people that don't have a job or don't have people or employers that provide insurance, it's astronomically more expensive than those who do have it offered.
You know, I appreciate your perspective, actually. I mean, you are quite excellent. You can tell that you understand the field. You're very knowledgeable. It's hands-on experience. You don't have a bias. You only care about what works. And we appreciate your taking the time to let us interrupt you as you tour our beautiful city.
Yeah.
Give comments to our national audience about a very important issue that's on the minds of the American people.
Sure.
Thank you so much for your
No
time.
problem.
All right,
No
thank you.
problem.
Good luck
Thank
to you.
All right.